Hello, welcome to the Enterprise Mobility Insights Outlook podcast. I'm Gina Daniel Lee, Vice President of Strategic Alliances and Partnerships at Stratix. We've got a really interesting topic today, home health. Because of issues with nursing homes and the broader strain on medical resources during the pandemic, a lot of patient care shifted to in-home. Clearly, this is not temporary. And turns out people prefer to receive care in their own homes whenever possible. And with the geriatric population growing fast as baby boomers are aging, the global home healthcare market is expected to hit 663 billion by 2027. That's a really eye-opening statistic, isn't it? There's massive growth going on right now with healthcare, but with the growth, there are some real challenges. For one, finding caregivers is very difficult. And with limited staff, people need to be as productive and effective as possible. That's where mobile comes in. Mobile devices play a big part in that. Not only do they increase efficiency, but they also help ensure the quality of care. IoT is also playing a part here with mobile devices enabling remote patient monitoring so caregivers know immediately if there's a problem. Joining me today to discuss this really relevant topic is Trevor Smith, who heads up healthcare business development for Samsung. Hey, Trevor, welcome to the podcast.
Thank you, Gina. Great to be here.
Thank you so much for taking the time with me today. And let's kick this off by having you tell us a little bit about yourself.
Fantastic. Thank you, Gina, for the opportunity. It's a privilege to have the chance to speak with you and to be in such great partnership with Stratix. Currently, I am the head of business development for Samsung Healthcare Mobile B2B, where I drive sales enablement, really owning and defining all aspects of healthcare vertical. I'm truly inspired by innovation and creativity, and I'm sincerely passionate about the care and wellness of the billions that make up this country. I joined Samsung after a successful career in holding various team lead and consulting roles in top technology companies as a leader in healthcare, state and local government, and education. And in my 8 years here at Samsung, I believe we positioned Samsung as a premier mobile solutions leader. I've had the privilege to work closely with many of the largest healthcare systems in the US, providing mobile solutions and in turn, solving extreme technology challenges. And way back in 2019, I was the recipient of Samsung's prominent Kin London Award for Top Solutions Professional. And I am excited to say that I reside in the beautiful state of Colorado with my incredible wife and two amazing boys.
That's quite a resume, Trevor. Thank you. So at the beginning of our conversation, I gave a little summary about the healthcare industry overall. And I know you are in front of customers and potential customers in this area all the time. How do you see the state of home health going? I mean, what's going on there, and how are some home health care providers coping with challenges like staffing, et cetera?
Yeah, thanks, Gina. First, before I begin to answer your great question, I want to begin with an unwavering thank you to all the frontline workers. You're all amazing, and the work you do is invaluable, and thank you so very much. As to the state of home health, I believe in the near term, many current challenges still exist. Right? The transitions from hospital to home are truly a key focal point today in healthcare. And I think that bodes the question, how do we harmonize between health systems and home care? I think this means closing gaps in health equity. I think it's balancing innovation with safety and creating new opportunities at a greater speed to success. Ultimately, in supporting telehealth, remote patient monitoring, and hospital at home programs.
So, Trevor, how do mobile devices help with some of these challenges?
Yeah, I think as we continue to be amazed at the creativity within healthcare, I think we're seeing more home care agencies looking to retain and gain nurses and caregivers with mobile technology. I think even providing an answer to what may have been what we could call a complex patchwork of standards is now being reimagined. I think nurses and caregivers are being provided with both a Samsung phone and Samsung tablet to support that workflow. It's about speed and accuracy in relation to data. So imagine, a full technology suite of devices upon new hire, or a refresh to an existing nurse or caregiver in support of staying current. I think ultimately it's a win-win-win for the patient, the nurse and the caregiver, and even the home care agency.
So let's talk specifically about staffing. I mean, limited staffing puts an absolute premium on efficiency with the resources you do have. And how can mobile devices help with that?
Yeah, how incredible is it, Gina, that home care agencies today have access to such powerful data platforms, right? It's equally as important that the digital touch points they utilize each day to support their interactions with their clients and patients. Now with the fast and easy cloud-based solutions that they utilize today to streamline their operations, all the while simplifying compliance and really boosting clinical and financial outcomes for home-based care agencies. I think with that, it's extremely important to have partnerships like Stratix that can support customized Samsung mobile solutions that really enable in real time those wireless data exchanges and the communication between field clinicians, the office staff for better care, and even more accurate reporting and good for the business, improved revenue cycle management.
So, around the topic of healthcare, there's always been a lot of discussion around privacy and HIPAA, right? I think that becomes even more prominent now that the patient experience has gone into the home. Talk to me a little bit about that.
Yeah, I think as part of Samsung's mission to help healthcare improve clinical communications and patient care, Samsung has ensured that all Knox, which is our security and management platform, that those APIs are HIPAA compliant. And Samsung also works with leading clinical communication software providers, which is extremely important that we have those partnerships, along with Stratix, to really share best practices and provide seamless integrations for a successful smartphone or tablet deployment.
And what about quality of patient care? How do mobile devices help improve that?
Yeah, Gina, I think we've come a long way in achieving greater interoperability between mobile devices and even ISV partner applications in the past few years. However, I think the goal of universal interoperability is still somewhat of a dream. I think mobile technology today, with the best platforms and the best networks, provide nurses and caregivers the digital information they need to really give care to their patients in an organized way, eliminating those burdens of sifting through heaps of data. And I'm certain you'll agree that without easy to use, reliable mobile technology, ultimately the patients suffer when that data then becomes missing.
That's right. And, Trevor, you and I have been in this mobile space for a while, and we both know that deploying mobile can be challenging in any industry or vertical, right? But what about healthcare? What challenges do home healthcare organizations face when deploying mobile technology into their environment?
Yeah, I've seen and or noticed a distinct evolution over the past few years. There was already a shift underway even before the pandemic, by which created a sudden critical need for effective professional services, right? Giving back to the home care agencies that precious time and the bandwidth to support and care for their patients versus spending a lot of time, a lot of energy in supporting a fleet of mobile devices. It's often said by healthcare customers, and it's one of my favorite statements that they shared, that the best mobile solutions are the devices you don't realize are even there. And I think with the increased level of mergers and the many acquisitions that are going on today, typically this means there are multiple teams needing to join the same platforms for efficiency and for cost-saving reasons. I'm a big proponent, Gina, of mobility as a service types of options, which I think Stratix does very, very well. I think it removes the heavy burdens of setup, the logistics, the security and management of the devices. And again, that ultimately is giving back time and energy to allow these agencies to focus on what they do the very best, and that's provide care and wellness.
I would agree with that. And, there's a lot of challenges in deploying mobile in like rural areas. In many industries, we talk about it in education, but I assume some of these same challenges apply to healthcare. Talk to me a little bit about that.
Yeah, this is without question at the top of the list of any healthcare provider, as I believe we want to do better for these communities. Distance and transportation always play a factor into any patient to obtain care. The shortages of healthcare professionals to support these individuals, which then increases some cases of social stigmas and privacy situations. I think this then brings to bear the inadequacy of and/or no healthcare coverage, along with poor health literacy. And then lastly, I think higher rates of chronic health problems such as high blood pressure and even obesity. I think mobile technology, Gina, is truly playing a major role in keeping these individuals connected to healthcare.
Yes, I completely agree with all of those challenges. And, let's talk a little bit about how home healthcare organizations can tackle some of those challenges.
Yeah, I think home care agencies are increasingly teaming with mobility solutions providers, just like Stratix, in addition to ISV partners, to really better position RPM and telehealth platforms. And that's in conjunction to Samsung's value tier phones and tablets to really ultimately support their needs. Obviously, cost, ease of use, and purpose-built devices using even Samsung Knox are an invaluable solution for these individuals to utilize in their remote care engagements. Not only is hospital to home a significant focus, but equally, delivering mobile devices to rural communities provides the freedom of care, health equity, and even cultural and social norms surrounding health behaviors.
That's great context, Trevor. Really good conversation today. Thank you. And if you've listened to our podcast episodes in the past, you know that I like to end with a few rapid fire questions that don't really have anything to do with our topic. Are you game?
I am. That sounds great.
All right. So the first one is, if you had to use a fake name, what fake name would you make up?
I think a great fake name for me would be Travorsky Dondahill.
I like that. Can you explain the origin of that a little bit?
My father used to call me Travorsky, and Dondahill just seemed like it fit well.
I love it. I love it. I think I'm going to call you that from now on. So what's your favorite hobby?
My favorite hobby is art, and my favorite medium is pencil.
Love it. Love it. I'll have to see that sometime. I can't even draw stick figures, so I'm envious of anybody who can actually draw. If you could pick 3 famous people to be part of your entourage, I don't think I knew you had an entourage, but who would you pick?
So I would need someone in politics, so I would choose Abraham Lincoln. I would need an athlete, so I would need Michael Jordan. And I would need someone that can sing, so I would choose Carrie Underwood.
I love that. That's a great entourage. Very good. Trevor, it was great to have you today. Thanks for joining me or for sharing your expertise with our listeners.
Absolutely. My pleasure. Thanks for having me, Gina.
Anytime. And listeners, if you liked what you heard and would like more information or would like to sign up for future episodes, please visit us at stratixcorp.com/podcast to subscribe. We'd also love it if you would rate and leave a review for any podcasts that you've listened to or suggest any future topics you would like us to explore. I'll see you next time. Goodbye.